Thanks to everyone for being here. This is the start of our program, and we wanted to start in the morning with ideas about preventive health and being well. A part of being well is actually having exercise, and exercise is really important. I can tell you, in evaluating patients and treating them for cancer, I ask patients, why didn't you get a mammogram years ago? Well, my doctor never told me to. So actually including exercise as a part of your treatment program and making sure that patients know exactly what you want to do is a part of what this is all about. I'm very grateful to a number of programs and businesses that are helping us with this. And to join me this morning, we have two distinguished individuals who work with preventive health programs in a number of places. The bios are in your booklet, but I have with me on my left, far left, Dr. Paula Cooper, and here, Dr. Robert Blancato. And their information is there. They will tell you about what they do. But I want to talk for just a few minutes on prescription for exercise. So why do we need exercise, and why should physicians write a prescription for exercise? And that is because obesity. Obesity is a big problem in this country, and African Americans are disproportionately represented in obese categories. So if we look at all African American women, 57% of African American women are overweight or obese. For men, a little bit lower numbers, but still very important. And you say, well, why obesity? You know, we're kind of healthy. And where I grew up, obesity was associated with being fine and being healthy and buxom and all kinds of other names that we had for being overweight. Well, being overweight causes several changes in many of the body's organs and functions, and that includes starting with the brain. So there are changes in the brain that occur as a result of the cytokines and other products that the fat cells make. So as one goes from normal weight to being overweight, you can see that there are multiple changes throughout the body: the liver, the fat cells, muscle, the kidneys, blood vessels, and all. So the body's functions overall are affected by obesity, and as the body enlarges and fat cells increase in number and size, we have changes in the body. And what that allows for are changes in metabolic pathways, so that the pancreas functions a lot slower, and therefore the development of dead cells in the pancreas and a lack of insulin. Not only that, muscle cells change, pathways change, and the body utilizes fat in a different way, so that overall body functions are affected, metabolic pathways change, and as the body increases in size, you become a different you, but in various metabolic pathways. So a prescription of exercise was formed by the NMA in conjunction with Black Health Matters, and we were funded initially by Coca-Cola. So we are writing prescriptions, and around the area, you're going to find those prescription pads. I want you to take them home with you. We can send you more if you need, and you actually write the prescription for what you want your patient to do. We actually started in Detroit last year in 2015 with a pilot program in the GYN section, and we've moved on to really demonstrating our entire program. So we're starting here, but we've also had much press about the program on the Tom Joyner Morning Show, and we've gotten about 800,000 questions and other news media as a result of prescription for exercise and the news media. So we are going on tour after this. We will be attending all of the regional meetings and then our big meeting in LA in July. So we've got a number of people participating and social media. So in conclusion, what we want all members of the NMA to embrace this program, pick up your prescription pads, write your prescriptions when you go back home for your patients. Now, this does not only apply to internists in family medicine and those of us in primary care, it applies to everybody. Everybody sees patients, and if you are a psychiatrist, your patient's brain will function better if there is a change in the body weight and body metabolic pathways. You can't separate the brain from the body. So it's all there working together. So no matter what your specialty is, if you see patients, write a prescription. If you don't see patients while they are awake, we've got anesthesiologists and others. Still, you see somebody and you have to evaluate patients for their pre-op. So at that time, you can tell, well, when you finish your surgery, here is a prescription for exercise that will help you. So everybody can figure it out. We are very smart people, and no matter what kind of medicine you practice, we can figure out how to encourage patients, engage your family, so that we're all utilizing the National Medical Association's prescription for exercise. So, Dr. Cooper, you're next. There's nobody that has 30. 10 minutes.
Good morning. Thank you all for being here, and just really happy to be invited to speak. What I do within the OBGYN and Women's Health Institute at the Cleveland Clinic is I take care of obese women in all stages of their lives: pregnancy, after pregnancy, menopause, postmenopausal situations in terms of weight. There's so many reasons why we gain weight, and one of them, of course, is being inactive. So inactivity, as you know, it's a leading cause of preventable death worldwide, right? Just sitting still for 4 hours can increase your risk for that significantly. And that is independent of hard exercise and a body mass index. So the health of individuals who exercise 4 hours per week, believe it or not, is equivalent to someone who sits for less than 4 hours per day. So it's really important to get up whenever you can and move as much as possible. We've had several calls to action, most recently the one by our current Surgeon General, and it's called Step It Up, and that is to promote walking and walkable communities. We have so many reasons why we're not moving as much as we should. Increased innovation technology, increased screen time in terms of computers and any mobile device, TV, longer working hours, urban sprawl, unsafe neighborhoods, urbanization without any green space. And so the call to action is really important in terms of making some of these situations change positively. This is the reason I hear the most from my patients about not exercising, right? It's the weather, and it's winter, and I hate this so much. I usually exercise when the weather is good. Well, if you're living in Cleveland, Ohio, or any other state where you're gonna have a true winter, that's at least 6 months of the year where you're not really moving. So we really have to do more about encouraging our patients to move. A lot of our patients don't like the term exercise, so just say move more. And given that I have a much shorter amount of time than I thought that I did, I'm just gonna flip through to where we really need to go. So, the exercise prescription starts with you. As physicians, as healthcare providers, we are so influential when it comes to helping our patients make the right decisions and taking care of themselves. So if you as a physician promote a healthy lifestyle, if you're an example of being fit and active, you will absolutely influence your patient to do this so much more, okay? So data has shown that physical activity habits of doctors influence their counseling practices. I'm imagining that most of the audience are OBGYNs, and in terms of that, the percentage of the population that's getting larger and larger, believe it or not, it's women. We are outdoing everyone in terms of our being overweight and obese. So with our captive audience, we really do need to promote the need to move as much as we can. So Exercise is Medicine was launched by the American College of Sports Medicine in 2008 in collaboration with a couple other organizations, the Medical Fitness Association and the American College of Exercise. And the reason this is important is because it gives a step-by-step guide for healthcare providers in terms of how to write an exercise prescription and how to write it in terms of not just the patient that has no chronic disease, but for the patient that does, because not everyone can just jump up and do things, right? We have osteoarthritis, we have other situations that are going on, and the exercise activity may need to be modified. As a physician, we're not trained to do that in medical school. Therefore, we need a guide. And what I love about Exercise is Medicine is that they actually have it step by step for you to follow very easily without any increased time. So when you are writing an exercise prescription for your patient, you really need to assess the physical activity levels of that patient. It consists of 2 key questions, which will take less than a minute. I know that sounds like, how can you just have less than a minute with 2 questions? But they're really quite simple and short and gives a great amount of information. And it's this: how many days per week do you engage in moderate to strenuous exercise? And how many minutes do you engage in exercise at this level? And the answers to those questions will give you a snapshot right away. Is this patient following the guidelines that are set out for us in terms of exercise activity? The American College of Sports Medicine updated the guidelines in 2011, and they added the neuromotor exercise. We really need more balance. We need more motor skills as we age. And so this part is very important in terms of promoting stability and developing physical function and preventing falls as we age. The PAR-Q is another way to screen and determine if your patient is ready for any type of exercise activity. And it's very simple. It's a 7-question screening tool that focuses on heart disease and musculoskeletal problems, those types of symptoms, just so you can, truly evaluate your patient and determine, okay, can I write this prescription for Mr. Smith or Mrs. Smith? And all of the questions, they're either a yes or no answer. And just those responses will be able to let you know if your patient can exercise independently or if the patient needs some type of supervision while exercising. Also, if they need to have more testing to determine that. do we need to do a risk stratification cardiovascularly to see if this patient can do the exercises that we are prescribing. There are many stages to getting ready in terms of physical activity, and I don't have enough time to go through all the stages with you, but your patient will be in one of these 5 stages, and this stage is really the hardest one. This is the one where you really need to try to motivate him or her, to get going in terms of moving more for his or her health. So what do we do? What do we need to do as providers? We need to repeat this message as often as possible. You can change the words. You can call it move it more. You can call it anything you want to, as long as you get your patient to do it. You really also want to emphasize the amazing benefits that exercise activity gives to you in terms of health, in terms of improving chronic disease states. It's amazing how it helps with insulin levels and just controlling cholesterol and the HDL and the LDL and all of those cardiovascular functions that are so important. So this is what we need to tell our patients. We need to write a prescription, and as Dr. Mitchell was saying, there are examples of an exercise prescription on the pads here. The exercise prescription pad will help you to determine what type of exercise, what workload, the duration and frequency, and the intensity that your patient needs to engage in for his or her state of well-being. This Exercise is Medicine solution is another new partnership which occurred recently where the American College of Sports Medicine is making it easier for us as physicians to do this. Once we write the prescription, we don't then have to feel inadequate in terms of our patient care by not having an exercise professional to refer our patients to. What they have done is they have collaborated with healthcare professionals and systems and fitness professionals and utilizing community resources so that once you write the prescription, the exercise prescription for your patient, you can then do a very easy referral. Thank you so much for listening to me so quickly. And this is where you can get more information in terms of really, truly knowing how to write an exercise prescription. So please make sure that you pick up one of the pads that are lying around here, put together very nicely by the NMA. And if you have any more questions about how to do it properly, just tap into that website.
Good morning. Thank you, Dr. Mitchell, for the invitation. Martin, nice to be back at NMA. I didn't want to be confused with being with CPAC, so I'm glad I got my name tag early. So I am the Executive Director of the National Association of Nutrition and Aging Service Programs, but also the coordinator of a new coalition called the Defeat Malnutrition Coalition. And I was told not to have a PowerPoint, so I'm going to just give you an address to write down, and this presentation you can get from this site. Go to defeatmalnutrition.today. Okay? www.defeatmalnutrition.today, and this presentation will be available to you starting on Monday. So, exercise and malnutrition. More attention is being focused on malnutrition than ever before. We have Malnutrition Week every late September. We have legislation that's passed in several states like Massachusetts and Ohio to recognize the issues of malnutrition. And yes, just yesterday, the Interagency Committee of Human Nutrition Research released its first nutrition research roadmap. And for the first time, they called for greater attention being focused on the knowledge gap specific to the role of nutrition and malnutrition and its effects on body function and clinical outcomes. So we have a hidden epidemic of malnutrition, especially among older adults. Malnutrition is poor nutrition. which most people define as overweight and obesity, food insecurity, and hunger. But malnutrition is all of those and more. Malnutrition simply means poor nutrition. It can be related to an excessive or imbalanced diet, clinical conditions that impair the body's absorption or use of foods, and a diet that lacks essential nutrients. And aging is a risk factor for malnutrition. The economic impact of malnutrition: there's a 300% increase in healthcare costs that can be attributed only to poor nutrition status. We have $157 billion in estimated cost of what disease-associated malnutrition costs the United States every year. And there's a 21.6% reduction in hospital costs for patients who use things like oral nutrition supplements. And malnutrition is associated with a high burden of disease, increased comorbidities, and significant economic costs. 1 in 3 patients are malnourished upon admission to hospitals. 31% of patients experience declines in nutrition status during their hospital stay. And malnutrition can increase the length of stay in a hospital by 4 to 6 days. So there are a number of solutions that are out there. They're multidisciplinary in nature. They involve the individual, the clinician, the hospital. But basically, the approach is we must deal with screening first, using a validated tool. We must do assessment following screening. We must do diagnosis following assessment. And we must commit to treatment following the diagnosis. But the role of nutrition and exercise, just like the role between nutrition and health, needs to be made stronger in our nation. We had a White House conference on aging this year, the 6th one in our nation's history. And for the first time, they identified one of the 4 priority areas of the future as healthy aging. And in that framework, our effort was to make sure that nutrition got a lot of attention in that setting. Because nutrition and exercise, when you eat high-quality foods combined with physical activity, it helps you reach and maintain a healthy weight, which is critical to good health. Physical activity lowers the risk of heart disease, diabetes, stroke, high blood pressure, osteoporosis, and reduces the risk of falling. And for older adults, that is a huge and growing issue. Studies showing more physically active people eat better foods. And even time when they eat, they time their eating to their exercise for better results, called precision nutrition. If you eat a healthy, well-considered meal 1 to 2 hours before exercise and another healthy, well-considered meal within 1 to 2 hours after exercise, you can meet both your workout and your nutrition needs all at one time. Diets, when combined with physical activity, improve health. All kinds of diets are noteworthy, such as the low-fat diet, the low-carbohydrate diet, or my favorite as an Italian-American, the Mediterranean diet. But the Harvard School of Public Health states the obvious. The best diet incorporates high-quality foods in appropriate portions. And a recent study that just came out dealing with the impact of nutrition and exercise on frailty for very old individuals suggests that combining an exercise program with nutritional consultation can, in fact, improve a frailty status of an older person. So there's proof in a lot of sectors that suggest that we should be spending more time focusing on nutrition and exercise. First Lady Michelle Obama has a wonderful initiative that's so important because it's focused on nutrition and physical activity, but she will make us look at both of these as being best done throughout the lifespan. Good nutrition throughout the lifespan, healthy living throughout the lifespan. But there's some legislative things we need to look at going forward in the area of Medicare reform, because Medicare is spending more time as it should on prevention than it ever did before. We need to expand medical nutrition therapy. We need to incorporate nutrition into care transition programs, which have come from the Affordable Care Act. We need to have more quality measures that include nutrition. We should have nutrition information and electronic medical records in the future. We need to strengthen the Older Americans Act and its nutrition program for congregate and home-delivered meals. We need to make sure that SNAP, the food stamp program, is not reduced because the need is growing among people of all ages. We need a strong senior farmers market program, commodity supplemental feeding programs. And I'll close with something that I heard just the other night at a dinner. Dr. Tom Frieden, the head of the Centers for Disease Control, said, he was asked what are the biggest challenges facing our nation. And this is a guy who runs the CDC, which is dealing with Zika and other issues. He said one of the biggest challenges we have to face is to reduce the gap between what we know and what we do when it comes to our health. So think about that. Thank you very much, and have a good morning.
So let's give our panelists another round of applause. So, Roz, where are you? Oops, not here. Alexis? Okay. Alexis is a medical student at Jefferson and works with me. She has a little survey for everybody here. So the surveys will be at the front desk, the registration desk. And if you would kindly fill out the short survey. And that short survey helps us understand a little bit more about it. And there are prescription pads. Who does not have a prescription pad? Okay, there are prescription pads all about, and they are at some of the seats. So, Roz, there you are. Raise your hand high so people can see you. Roz will be giving out prescription pads, and I'd like for everybody to go home with that prescription pad, use it, and join with NMA in the fight against obesity. Now, our question and answers are going to be out in the hall, so we will be around. We need just a moment for some technical arrangements to begin the next session of our program. So thank you very much for getting up early in the morning to know and engage in prescription for exercise. Thank you so much.